we're not going to have mandates on people to go get vaccinated. We've been through that with COVID, and we don't want to go in that direction.
Thursday afternoon, Governor Henry McMaster addressing the spike in measles cases in South Carolina. Right now, there are 114 documented cases statewide. Public health officials push the importance of vaccinations, but the governor says that's a personal choice.
People need to understand it's dangerous, just like a lot of other diseases. If there's some way to prevent it, you ought to do it, unless you have some good reason not to, but it ought to be a real good reason not to, because measles can be very dangerous.
We previously reported that an increase in cases was expected due to settings of public exposures that had been identified, but this significant jump in cases is unfortunate.
State epidemiologist Dr. Linda Bell says not enough people are getting the MMR vaccine. This week, the department reported 27 new cases in the state since last week.
So in total, there are currently 254 people in quarantine and 16 in isolation.
According to health officials, 16 of those cases came from a church in Inman, and 3 came from upstate schools. Bell says measles is a highly infectious disease that can spread very quickly, but it can be prevented.
Vaccination continues to be the best way to prevent the disruption that measles is causing to people's education, to employment, and other factors in people's lives in our communities.
Bell says everyone should get vaccinated to avoid the disease and potential quarantine if exposed. But if you are exposed to measles, Bell says there are steps you can take.
Those potentially exposed to measles should notify a healthcare provider of the exposure before seeking care so that the facility can make arrangements to prevent additional exposures in a healthcare setting.